Alright, so my name is Colby. So the purpose of this video is I'm going to teach our student here, Lexi, how to do palpation of the hip and the pelvis. So we're going to start off by going through the objectives. Alright, so our objectives for this demonstration video are going to be demonstrate proper palpation techniques while identifying landmarks of the hip. And number 2, identify all prominent landmarks associated with the hip. This includes ischium, the ilium, and the femur of a partner. And so our partner or patient today is going to be right here. And then number 3 is going to be identify all prominent muscles that attach to the bony landmarks discussed in this presentation. Okay, so we'll start off by, I'm going to demonstrate here on the skeleton, right, and then I'm going to have you palpate on yourself, and then we'll go ahead and find on the patient. All right, so I'll bring the skeleton over here. Okay, so first we're going to start off with the iliac crest, right? So, but first, we want to kind of orient what we're looking at here. So if we're looking at the skeleton here, I'll turn around, so now we're looking anterior view here. All right, we have the pelvis, which is the entire pelvic girdle here, right, and then the top of the femur. All right, so our pelvis is going to be the ilium, which if I turn right here, is going to be this bone, comes all the way around here. That's all going to be your ilium, right? And then in the posterior aspect, we turn skeleton around. We're going to have this all right here underneath my finger is going to be our pubis, or excuse me, our ischium. So we're going to have ilium, ischium, as we turn around to the anterior view. Okay, then we're going to have right here the superior ramus here, and going down and around, all that is going to be our pubis. Right, and then we have both left and right. So that's going to form the pubic symphysis, which we're going to get to here soon. But those 3 bones all make up the pelvic girdle. Now, next, we're going to look at from the anterior view. We have femur here, laterally, okay, and then the pelvis. So your hip is going to be that approximation and the articulation of the head of the femur, which is all right here, and then articulating with that acetabulum of the ilium and the pubis. So that is going to make up our hip joint. Okay, so we'll start off by just identifying some landmarks. So you've learned the hip, so you kind of know some of these landmarks. So I'm going to have you show you one here, palpate on yourself. Right, so iliac crest, very easy. Right, so if you come down here on the sides, you make a little L with your hands. Come here, come down. That's going to hit iliac crest. You feel that in yourself right there? Cool. So you can here and come down. All right, that's our power stance right there on the iliac crest. Okay, so that hits our first landmark. So we'll go ahead and demonstrate on our patient here. So for the purpose of this video, we are wearing masks. We're going to make sure our patient is okay if we palpate. Are you okay if we find? Okay. And we sanitize our hands beforehand. Okay, so I'm going to go ahead and lift up your shirt. Is that okay?
Yep.
Great. So right here again, we're going to go, just going to tuck it up here. Excuse my cold hand.
That's all right.
We're going to come here, make the L, and go straight down. It's going to be the iliac crest. All right, so I'll let you come palpate here.
Yes.
Good, yep, make sure you're always just getting consent of the patient, make sure it's okay, good. And then a couple things for palpation, this whole video, we just want to make sure that you're using as much surface area of your hand as you can. So on that one, you know, you don't want to just use little spider fingers and poke around. You want to make sure that you're getting all of that iliac crest. So I'll show you over here, come down, right there. Great. All right, Taylor, you can go ahead and back up right here. So the next one I'm going to show you is the ASIS. So if you look at the ASIS, okay, the technique for finding this is you find iliac crest, which we just identified, right? And then you move distally and anteriorly on the iliac crest down to the ASIS. So if you follow your hand down, you hit that bony prominence right there, which you're going to run to, which is the ASIS. Okay, so real quick quiz. Can you name a muscle that it attaches to the iliac crest?
Transverse abdominis.
Good, transverse abdominis, yeah. So your obliques and a lot of those abdominal muscles are going to attach there. Now, if we move down, coming on this ASIS, can you name a muscle that attaches there?
Sartorius.
Sartorius, good. This is pop quiz. Do you know the function of that muscle? Yeah, there you go, good. Yep, external rotation, flexion, abduction, excuse me. So, Next, we're going to have you palpate on yourself. So it's a little bit harder through the clothes, but if you find that crest, and you just run your hands down, and you're kind of just going to fall off that cliff right there. You feel that on yourself? That's going to be your ASIS. And then actually, if you do that motion there, and you push down, you can kind of feel that muscle tighten as you do that. Great. So we're going to have our patient lay on her back, supine. Go ahead and lay down for us. Okay, are you comfortable to roll up your shirt?
Yes.
All right, cool. All right, so again, I'm going to grab this sheet here. Make sure we cover our patient up as much as you can. So you take the sheet up here, and you can just tuck it in their shorts, just like that. Okay? So hers is real easy. She's very prominent, ASIS. So again, technique, we're going to go here. Just don't mind my hand.
Okay.
Feel that crest. We're going to come down, all right, until we hit that bony prominence just right there. So if you want to bring that camera in here, and you can see right there, both of those ASIS. So I'm going to have you go ahead and demonstrate there. Yep, so again, find that crest, move anteriorly and distally until you fall off that little cliff. Good, I'm going to move that here for you. You feel out there?
Yep.
Cool. How's that feel? Feel okay?
Yep.
Good, make sure we're checking in with him. All right, so next we're going to do the PSIS. So for now, we'll have our patient just hang out right here. We'll have her turn over in a minute. I'm going to show you here on the skeleton first. All right? So now we're looking at the posterior aspect of the pelvis. All right, so the techniques to find this one is we're just going to go down the transverse process for lumbar spine with these landmarks right here. It's a little bit harder to feel in yourself. All right, then we're going to go down those transverse process until we hit right here on that bony landmark on both sides. So we're going to go like this, run into it, and you're going to feel that little mountain that comes up there at you. Okay, just looking at this, little pop quiz. What spinal segment goes at the level of the PSIS?
S2.
S2, good. Yep, so you can see that here. As we come down right here, you have that S2. Now that sacrum is right there at the level of the PSIS. All right, and you can even find it on yourself here. So I'm going to move back here. If I go like this, and then I put my hands on my back, kind of bend forward, and as I come back, move my hands down, and you go like this and extend back a little bit, you can feel that PSIS right there. Cool. So this one we're going to have our patient roll over on her stomach, prone. Move this here for you. Okay. I'm going to ask my patient, do you mind if I roll up your shirt?
That's fine.
Perfect. Okay, we're going to do here, we're going to tuck this sheet into her shorts here. Okay, so again, really going to be easy to find this on her. So where are we going to start with our hands?
On the transverse process of the lumbar spine.
Yep, perfect. Transverse process of lumbar spine. Then what are we going to do? Just move distally. Just move distally down that lumbar spine on the transverse process, and then we're going to run into that right there. Boom. So you can feel, is that painful for you at all there?
No, you're okay.
No, it can be a little tender sometimes. So you can see right there, those two landmarks of the PSIS. So I'm going to have you try here. You feel that there? Yep, and if you move your hands a little bit distally, you can feel it kind of just wraps around. And then you can feel those little bony prominences that come right there of that PSIS. Okay, so this next one, we're actually going to have our patient stay prone. We're going to do the ischial tuberosity. So I'm going to go ahead and I'll move this up here. All right. So for our ischial tuberosity, all right, this is going to be looking at the posterior aspect of the pubis. Okay? So right here, remember I said that, what was this bone back here on the pelvis? Ischium. Yep, I said pubis just barely. Excuse me, that was ischium. Yep. So that right there is going to be the ischial tuberosity right there on the ischium, like hence the name, right? So a lot of times when you have someone sit in your lap and you say you have a bony butt, it's actually the ischial tuberosity, which is poking you there. Okay, so you've identified in the skeleton. A little bit harder to find on your own self, but you're sitting down maybe. So we're just going to go ahead and demonstrate directly on our patient. Cool. So I'm going to move the sheet down, take your shorts up here. All right. So the technique for this. So we're going to have our hand, or our forearm, excuse me, right there in the back of the patient's leg on their hamstring muscles. Okay, so I'm going to lift your shorts up. Is that okay?
Mm-hmm.
Okay, so we're going to go here, forearm on the back of the hamstring, and then we're just going to slide our hand up until our hypothenar eminence, right there on our palm, hits that ischial tuberosity. Right there. And you can actually do with hand too. If you just put your fingers down, move up, and then run into it right there. Okay? So I'll go ahead and lift this up for you. All right, we're forearm on the hamstrings. Heel of your hand there. And you feel that there?
Yep.
Sweet. All right, pop quiz. What muscle, or what muscles, you can name more than one, attach to that ischial tuberosity?
The long head and the biceps femoris.
Nice. Yeah, your hamstring muscles, specifically that biceps femoris long head, attaches right there. What function does that muscle do?
Hip extension.
Yeah, and what else? Yeah, knee flexion. Perfect. Which goes right into our next landmark here, which is going to be the ischial tuberosity. All right? So I'm going to have our patient hang out here. You can go ahead, you can roll over, get comfortable if you want. I'm going to show you on the skeleton real quick. Oh, excuse me. I said ischial tuberosity. I meant greater trochanter. That's what I meant to say. So our next landmark is going to be that greater trochanter. All right? So the reason they call it the greater is because there's always what? A lesser. Yep. Anytime in the anatomy you have a greater and a lesser, that's going to mean, or if you hear lesser, you're going to have a greater, vice versa. All right. So we're looking here now, the posterior aspect of the femur and the pelvis. Okay. So we have this landmark here, which is going to be greater trochanter. Perfect. And then what is that one there? Nice. Do you know what trochanter means? No? Okay. So it's actually a Latin origin. Right? So canter means to run, like a horse, when you do a canter. So the reason they call it the trochanter is just because it's your femur bone used to run. So it's named after a horse. Kind of fun fact, right? Most anatomical features on like landmarks on bones are from the Latin origin. Okay. It's kind of gee whiz, cool, right? Okay, so we're gonna have you stay supine here. We're gonna go ahead and find that greater trochanter. So easiest way to do it is you just take your leg right here. Do you mind if I grab your leg here? Is that okay?
Yep.
All right, and now we're gonna lift your shorts up a little bit. Is that okay?
Yep.
Okay, and now what we do is you're gonna rotate their leg, external rotation and internal rotation. And as you come here, all right, you're gonna feel that landmark pop out on the hip. So if you come around this side, okay, you're gonna go here and you can feel. See if I move your leg in and out, you're gonna find that greater trochanter. You can actually find it on yourself too. So if you take your leg hand, put it out here in your hip, just kind of lift it up a little bit and just go in and out. You feel that pop out?
Yep.
That's your greater trochanter right there. So I'll go ahead and have you find it on her.
Is that right? Yep.
Cool. So, quiz. What muscle is attached to that greater trochanter?
Lateral rotators.
Yeah, perfect, right? So it kind of makes sense why we were moving it in and out like that. They were feeling that landmark pop out because we have our lateral rotators. Okay, last one. So this one, as I mentioned previously, we'll have you come right here and I'll show you. Now looking at the anterior view of that pelvis. Okay, so we talked about ischium, the ilium. Now what third bone do we have right here in the front? Pubis, yep. Right, so now on both sides, both left and right, we have a pubic bone, all right, that forms this pubic symphysis. Okay, you know what connects those two right there? Yeah, exactly, right? Cartilage, yep. So it's cartilage, so it can be very fragile, very vulnerable, right, if you're getting a lot of trauma. Also, I mean, the hip is used for a lot of leg length discrepancies, right? So, you know, the more like hypermobile we have this joint, we can get some pelvic movement, which can be bad day, right? So, first, we're going to palpate this on the patient. We're going to have you palpate it yourself first. So, oh, sorry, we're not going to have you palpate it yourself first. Apologize. Okay, so I'm going to come here, lift the patient's shirt up, right? And say, all right, I'm going to tuck this in your shorts and move your shorts down a little. Is that okay? Yeah. All right. So, again, we can orient ourselves a little bit. We got the ASIS. We've already found that crest. Okay? Now, the easiest way to do this is just have your patient put their hand right on their belly button or their umbilicus. So you go ahead and put your hand on your umbilicus there. You're going to help them put a little pressure down right there. And then I'm going to put some pressure on your hand, and we're just going to move it down until you run into that landmark right there, right? That's going to be pubic symphysis. So go ahead and have you demonstrate that first.
And I'll just put your hand on your belly button, put it down on no pressure, put it down towards the
Perfect. You can also palpate that yourself. So we want to make sure it's okay with our patient. All right, is that okay if we try to palpate ourselves?
Yep.
Okay, so we're going to put our hand right there below the umbilicus. And just come straight down until our fingers run right in there into the pubic symphysis.
Yep.
You have to apply a little bit more pressure, and then the top of your fingers will just run right into it. Perfect. Okay, and that concludes all the landmarks of the hip and the pelvis. Hopefully you feel like you're an expert. Thanks for watching.